Globally, it's fairly well known and acknowledged that we have a shortage of clinicians on the ground. Mental health is a massive challenge in our society. It's something that in the past we've probably just brushed aside, but there is quite a focus on that now as well. And there has not been a lot of investment in that sort of technology-enabled experience, because the focus is always on spending money on the things that matter from a clinical delivery perspective. Generally, what we'll find is progress in AI that is making clinical decisions is a lot slower paced than the progress in AI that is doing things which are more administrative in nature. In the Australian health sector, we've not had our own Australianised standards for data exchange, data formatting specifically, up until recently. But where it is clinically appropriate, care in the home tends to be cheaper to deliver. It tends to be safer to deliver in terms of complications, hospital-acquired complications in particular, and it tends to be a better experience.
Hello and welcome to the Enterprise Tech Talk podcast. I am your host, Saumitra Kalikar. Healthcare is one of those complex and important sectors which is being reshaped by technology today. Globally, health systems are facing many challenges due to aging populations, workforce shortages, affordability pressures, and so on. But at the same time, new technologies are advancing, which are creating new opportunities which were not even dreamt of a decade back. New models of care are emerging, such as virtual care, remote patient monitoring, which are reshaping how healthcare is delivered and experienced. Today, we are going to unpack these shifts, both at global level as well as Australian level. And to join the discussion, I have with me today Matt Young. Matt is deeply passionate about improving health system within Australia. He's currently the lead enterprise architect at Medibank. Matt, welcome to the podcast. Great to have you here.
Thanks, Saumitra, and great to be here as well.
Many listeners would know Matt and I have worked together in the past in Medibank. It was a great time, Matt. How are you doing these days?
Yeah, doing very well, thank you. We do miss not having you around, but great to see the podcast doing really well.
Thank you. Maybe for our listeners, Matt, tell us something a little bit about your professional background, how you got into healthcare, and what keeps you motivated being in this domain.
Yeah, so I started as a digital engineer back in the day, over 20 years ago now. And that was with a small company called Eclipse Group, who were at the time partially owned and then fully acquired by Deloitte and became Deloitte Digital. So I kind of fell into the Deloitte world and into the consulting world, even though I was an engineer as such. And very quickly sort of moved through, as a lot of people do, sort of the engineering disciplines and competencies where you do sort of more of your lead engineer and solution architecture, those sorts of things, and ended up leading our .NET engineering practice there, and then was looking for the next challenge, moved into more of a consulting role in technology strategy and architecture. Worked across a number of different sectors, including defense and education and health. And when I did, after doing my first job in health, I went, yeah, this is what I want to do. Finally, it had clicked. And so I've now been working in health for close to 15 years in the health sector. So quite a long time now.
Let's start with a more broader context, Matt. When you look globally, there are some common challenges which I think most of the global health systems are struggling with, right? So can we start with that? What are the key and common challenges health systems are facing today? And then maybe follow up how organizations are actually responding to those challenges.
Yeah, look, globally, it's fairly well known and acknowledged that we have a shortage of clinicians on the ground, and so with population growth, and in particular in Australia, an aging population, so that cohort above 60. Our boomer parents, etc. They, there is a large population, sort of in that age group, which is putting stress on our clinical workforce in terms of being able just to deliver the amount of care that is required. Care is also quite expensive, can be quite expensive to deliver as well when you're talking about acute care, building hospitals often, there's a lot of medical equipment that goes on as well. And so the costs also to serve in terms of healthcare is, quite substantial. And you'll see that in Australia in terms of the expanding health budgets. And even things like often we will see the cost of things like private health insurance going up above inflation rate due to those cost pressures in the system as a whole. There are a couple of the big things that we see all over the world, as well as particularly here in Australia.
Yeah, and particularly in Australia, what are the key policy changes government considering or have been considering in recent past to actually address these pressures?
Yeah, there's a number of things that both state and federal governments have been doing. So for those who don't know, in Australia, we have our federal government looking after primary care, which is your local doctors, your GPs, those sorts of things. And then you have your state governments looking after hospital-based care. And they kind of do that in conjunction. And so there have been a number of recent things that the government have been doing to assist in reducing pressure across this system as a whole, which was really great to see. So some of the things that they've been doing, for example, is that they have been providing more funding for more acute care in the home. So under the recent Support at Home, which is our aged care in the home policy, they've actually increased funding for the clinical support in the home. So in particular around nursing and allied healthcare in the home. And the more of the, non-clinical daily living support services, there's a bit more of a co-payment involved in that. So they are putting more funding towards the clinical side of things to keep people in the homes for longer, so that you don't have to build as many residential aged care homes and hospitals, which is really great to see. Another recent one which I came across was that the government is also investing $140 million into grants around preventative health, which is another one that's really great to see. And so we all know that prevention is better than cure, but prevention is also really hard to do. And you've really got to do it in conjunction with sort of, primary care, which is the GP, that is the hub of sort of our care system. And so there are a number of initiatives around preventative care that are in train, and a number that the government's seeking ideas for in terms of grants around that, which is really great to see as well.
Great. I wanted to actually unpack the preventative care a bit more with you anyway, so that's a good detour.
Good segue.
Good segue. And because as you probably mentioned, the shift is happening, not necessarily in Australia, but I would say probably across the globe. There is a wider acknowledgement that healthcare system needs to move or shift from treating illness to actually preventing the illness, right, in the first place, right?
Yeah.
And live and focusing on how people can live healthy in the first place for a long time. So, what you mentioned is definitely encouraging that Australian government is actually funding this particularly. But how organizations, the hospitals, or the healthcare systems itself is actually getting ready in Australia? What kind of programs, services are emerging to make that shift to actually focus disproportionately on treating wellness and prevention programs as a complement to treating illness?
Yeah, look, it's a really interesting one. So there's a few different approaches from a sort of a prevention perspective. One is modifiable risk factors in particularly in chronic disease. So managing things like obesity, weight management, etc. That is a massive risk factor. Smoking is a massive risk factor. Drinking is a massive risk factor if it's done excessively. And so, giving people the option of being able to access services, and particularly free services in that space is really vital. Then you've got like early intervention type programs. So the government has invested quite heavily in the Medicare mental health access lines and local Medicare mental health centres. Mental health is a massive, challenge in our society. It's something that in the past we've probably just brushed aside, but there is quite a focus on that now as well. And so, there are definitely things happening in that space from a more sort of systematic government perspective. I work for Ampler Health, which is part of the Medibank group, which Medibank is a health insurer. And obviously health insurers also want to keep their members healthy as well. And so there are a range of programs that Medibank run, and I know other insurers run as well, other private health insurers run, which are specifically targeted at their member cohort as well. And that's both around, helping them identify where there might be, potential risk factors which can be modified through, various easy to access health checks and those sorts of things. And also then, programs to help behavior modification as well. And once again, there's, mental health behavioral modification programs, which are, quite, well advanced, particularly in sort of the mental health space and some of the behavioral change in the mental health space. There's some really great organizations out there doing some good work in that space in particular. Probably one of the ones which I would call out state government wise. I live in New South Wales, and the New South Wales government has a program called Get Healthy, which is free and available to all people, where you can ring up or jump on their website and access a whole range of information and programs if you're deemed at risk as well. So yeah, it is definitely starting to happen. We would always recommend also, regular check-ins with your GP as well. They are certainly the we encourage people to have them at the center of their care.
Yeah. And what role does technology play or is playing now in this health and well-being and early prevention phases of
Yeah, look, there are a lot of digital tools in terms of that. So things like health checks, digital online health checks, a bunch of those are now moving towards more, agentic chat type flows, so that it's not necessarily such a structured, form that you might fill out, but more of a, sort of a asynchronous chat-based interaction.
Yeah.
And that is a relatively common thread that we're seeing across a lot of the digital tools, is the ability to do both asynchronous and synchronous web-based, chats. Having nudges coming through to remind people to do certain, lifestyle activities or education. That's not particularly, world breaking in terms of the pure technology play, but it all adds up in terms of the way that you're interacting on a more regular basis than what a physical clinician can do, right?
Yeah.
And that's really the intent here, is to give people little nudges along the way, and to help people along the way, and not to replace the clinician, but to basically fill in the white space between when you might be talking to a clinician one time and the next time you might be able to access that, and help the clinician to operate at what we term the top of their scope, right? So they're not doing a lot of admin tasks. They're focused on the clinical care as opposed to admin tasks.
Yeah. And I want to unpack definitely the role AI is playing in the healthcare.
Yes.
But before we go
Absolutely, we can go there.
Yeah. But just before we go there, so what's in the technology space? What's the role the wearables is playing now? Are those being well embedded and integrated in the health workflow now?
Yeah, look, there's probably a couple of different classifications of wearables. So you've got your more sort of, general, consumer grade, I would call it, even though a lot of them are now getting towards medical grade. Devices like your Apple Watches, your Garmin Fitbits, etc., all those sorts of things, Garmin watches and Fitbits and all those sorts of things. So they do provide a lot of information. I'm an Apple watch user, and the amount of information you can do, like ECGs, single lead ECGs on there, and all sorts of, oxygen saturation, pulse, temperature, like there's all sorts of things that you can do with those devices and have it just running in the background, which is quite amazing. It also obviously gives you more generic activity-based steps, those sorts of things. So we are seeing more of that. Then there is definitely a lot of advancement in more of your, medical grade wearables as well. So things that might, for example, track, blood pressure. There's plenty of wearables around blood glucose monitoring, continuous blood glucose monitoring from a diabetic perspective as well. So we are seeing a lot more of that. I don't think we've quite seen the explosion of wearables embedded into clothing and those sorts of things yet, but it is coming.
One thing I wanted to unpack with you was around the consumerization of healthcare. And what I mean by that is more and more customers are expecting the same experience as they get from, let's say, from the banking, retail, travel kind of sectors. They are looking for similar experience in healthcare, right? Which is much more digital focused, etc. Right? How healthcare organizations are getting ready to deliver those experiences, and what kind of particularly when there is so much of complexity when it comes to clinical operations, regulations, etc.
Yeah, it is a real balance between the privacy and security side of things and what you're allowed to do in that space, which obviously also then goes into the AI space as well, right? And the customer experience. But there is a lot that can be done in the customer experience which hasn't been done from a health system perspective. And we expect to be able to do things like, the book online, see all your data online, etc. And that's starting to occur in terms of that. So certainly there have been quite a few advancements in the My Health Record space and in what people are actually sharing. Obviously, that's opt-in. You don't have to have your data in there, but you can choose to. Sorry, it's opt-out, but you can opt out. So you can choose to not have your data in there. But yeah, certainly it is moving towards a more digital-centric environment, particularly in the primary care space. It is heading more towards there. I think historically there has not been a lot of investment in that sort of technology-enabled experience because the focus is always on spending money on the things that matter from a clinical delivery perspective. So that's been the mindset in the past. I think now people are certainly thinking through, how they might provide a better consumer experience overall. And there are certainly a bunch of companies out there who are doing a lot in that space in the primary care area as well.
Right. Let's move our focus to AI and automation and intelligent healthcare system. Of course, no sector is untouched by AI now, right? But when it comes to healthcare, where health organizations are seeing as potentially the low-hanging fruits where they actually get benefited from AI before they jump ahead to address the more complex workflows.
Yeah. So in the healthcare sector, the software that is involved in making clinical decisions is regulated by the Therapeutic Goods Administration, the TGA. And so generally what we will find is progress in AI that is making clinical decisions is a lot slower paced than the progress in AI that is doing things which are more administrative in nature. That is quite fast paced. And so there is a lot of human in the loop in the AI in the clinical space because there needs to be that clinical review step. And there is a lot going on in AI in health. So I can probably give you a few examples. Heidi AI. Heidi have been doing a power of work around, they started off in doing what we call clinical scribing. So that's essentially listening into a conversation between a patient and a doctor and being able to automatically create a quite an accurate clinical note, your progress note based on the conversation without the doctor needing to be sitting there typing, etc. Can also be used to create things like referral letters and those sorts of things. So they've been doing really well internationally. And one of the AI assistants that they have just released is essentially an AI receptionist / admin staff for a primary care business. And that has the ability to do things like have web voice channels to be able to then manage all of the bookings back into the practice management system. So that's creating bookings and then changing bookings and doing all that side of things, answer basic non-clinical questions that someone might have, etc., with the intent to really free up the receptionist to be able to be in the clinic dealing with the people, doing things like the billing and those sorts of things that they do. And so, there is a view of, well, maybe I used to need, like, if I'm a really busy practice, I need 2 or 3 people on my front desk. Well, maybe now I only need 1. And so that's certainly, that's an example of somewhere where, AI is being used. The ability to do things like create care plans based on a whole bunch of documentation that you might get for an aged care patient. That's another use case that we've seen recently pop up, where a care plan is essentially created off the back of things like the aged care assessment that was done, a whole bunch of other documentation you might have gathered about the person, assessments you might have done around falls risk assessments and things like that. And all of that can automatically be summarized into an overarching care plan, then be reviewed by the clinician. So they're not trawling through documents, writing reams of documentation to create this care plan. They can basically review it and add and subtract things as they need. But that's a significant time saver in that space. So there are many use cases. The broader sort of AI from an analytics perspective, if you include things like your machine learning algorithms and those things, we're looking at things like roster and schedule optimization and those sorts of things using those types of tools, best practitioner matching between a patient and a practitioner. There are many broad use cases that are not directly clinical. Then there are some that are directly clinical. So Harrison AI is a great example of a clinical system that basically can read radiology images and then create a draft report that can be reviewed by a radiologist. Once again, saving a significant amount of time, potentially picking up things that may have been missed as well. And that's gone through extensive validation as part of their TGA approvals. There's a broad spectre of that. The low-hanging fruit is definitely more in sort of that admin space, with the view to keeping that human touch, keeping human in the loop, particularly when it comes to anything remotely clinical.
So apart from leveraging the AI solutions in the market, is there a appetite within health organizations to build agentic systems internally, which can actually automate their custom workflows, clinical workflows or administrative workflows?
Yeah, look, I think the way that we are, so yes and no, I think is the answer to that. The way that we are approaching that is leaning on our vendor partners. A lot of them are building AI capability into their platforms to allow us to do that. So we're not having to stand up our own, agentic AI, capability ourselves in that space. I think there are, we are, looking at some of our broader, sort of enterprise back office type tools as well, and what we can do with those to automate some of those other, admin processes in the background as well. One of the common use cases I've heard also is things like, the ability to trawl your clinical knowledge base, right? And summarize things out of your clinical knowledge base. So it's another great example of where, AI can save you a lot of time by actually creating that summary with referenced links. Obviously, that's really important. As a clinician, you want to trust where that data has come from, and be able to go directly to the source as well. And so that's another really great example where if we're working with, for example, a dietitian who might be looking for what's the best advice for creating a meal plan around this type of condition. We might have some of that in our clinical knowledge base already, and you can kind of curate that information in an easy fashion for them.
Yeah. The other challenge or complexity I wanted to unpack with you in healthcare space is around data interoperability.
You hit my two buzzwords. I was just thinking before this conversation, there are two things out of the latest Digital Health Festival, which I attended not long ago. For anyone who's interested in health and technology, Digital Health Festival in Melbourne in May each year is an absolute must go to. My reflections on sort of my time there this year and my conversations with people were the two big themes were AI and interoperability. So you totally hit the nail on the head there.
Yeah. And I want to unpack that because as you and I know, interoperability has been one of those challenging areas within healthcare for a long time.
It has.
And continues to be the case, although there are some standards emerge now. Do you want to paint a picture as to why this has always been such a big challenge, and what are the standards emerging? How organizations are now started to address this?
Yeah, so I think there's in the Australian health sector, we've not had our own Australianized standards for data exchange, data formatting specifically, up until recently. There've been pockets of it, and so by pockets I mean things like e-prescribing and secure message delivery, and some of also the data going into My Health Record also was quite well defined in terms of the HL7v3 specification around that. But generally across the health system, the data structure and formatting structure was controlled by a text-based message platform or protocol called HL7v2, particularly relevant in the hospital sector. And fax was extensively used for data exchange, which is slightly transferred now to email being used extensively for data exchange in some parts of the health sector. And so back in the mid-2010s, a new health data standard called Fast Health Interoperability Resources, FHIR or FHIR, emerged, and that has been adopted by Australia and the US and fairly well internationally as the standard for data formatting and exchange. It is based on REST-based APIs with JSON or XML payloads, and Australia recently released its own implementation guide around that, which includes extensions that are localized to Australia. Now, with the advent of that, along with a really good set of data standards around the actual data that goes into that format, which are things like, your medication standards, your disease classification standards, your observation classification standards, all those sorts of things. So we've got a whole bunch of those standards that are, once again, specific to Australia. They're international standards, but been tailored to Australia. So we can now use those standards to ensure that the data within the FHIR format is also a standardized data set as well. So we are getting a lot closer to, I guess, that sort of dream state of, ubiquitous data interoperability. It will take the sector a while to get there as a whole, but the Australian federal government, through the Australian Digital Health Agency, is leading the charge around that, and also implementing the FHIR standard for My Health Record as well.
Yeah, and from consumer perspective or patient perspective, then what would good look like? What is the experience they will have? What are the problems they face today which will go away?
Yeah, look, a classic problem that we might have today, for example, although it's just recently been resolved because all pathology results are now going up to My Health Record. But for example, if you go to one GP, they may receive your pathology results. If you then move and go to another GP, the results then go to that GP. If it wasn't uploaded to a central repository, you wouldn't have a history of your results unless you specifically went and asked the GP, please, can I have your results, or keep it paper-based or whatever. And so My Health Record certainly does, allow that continuity of care from a data perspective, should you choose to have that there. And so you can have all of your pathology results. You can have things like your prescribed medications in there from a medications perspective. You can have your immunization history in there. You can have advanced care directives as well, particularly important in, sort of as we, move towards an older generation and more palliative care going on, etc. Having access to advanced care directives readily available is super important. So all of those things as a consumer means that my clinicians whoever my clinicians are, can also access that and are able to provide me with the most appropriate care, which is really what I as a consumer want.
Yeah. The topic I wanted to unpack with you, Matt, was about the emergence of new models of care.
Yes.
Right?
Yep.
And over the last 4 or 5 years, there have been these new care models which are emerged. In the primary care, for example, it's the virtual care model, or in the hospital care, it is about the hospital in the home settings, etc.
There's a big push around hospital in the home at the moment.
So to start with, from virtual care perspective, what is the, maybe at a high level, if you can paint a picture for our listeners to what does it mean, virtual care, and then what is the infrastructure or technology investment that is typically required to build the virtual care experience for patients.
So virtual care basically means receiving care when I'm not there in person, right? And so through COVID in particular, a lot of us would have experienced that, even the most basic sense of just getting on the phone and talking to someone. So as an example, the Health Direct, sort of nurse helpline that you can ring 24/7 is a great example of a virtual health service that has been around for a very long time. What we've seen with the through COVID and the emergence of additional technologies and acceptance of virtual care is the expansion of that into different channels. So by different channels, I mean we've moved from probably being predominantly phone based, and there is still quite a bit of phone based care, through to using video conferencing as a fairly good mechanism to use, as well as then messaging as well. So there are some services that support asynchronous-based care, asynchronous message-based care. Now, obviously, sort of, we need to be careful in that space and make sure it's appropriate in terms of that. But certainly things like if you're in the mental health space and it's, you're in a behavioral change program, then that is quite appropriate to receive, message-based asynchronous care virtually. And so, it's about horses for courses, obviously. In terms of the tech stack that supports that, typically you do have a typical practice management system sitting in the background still, where the clinician's able to manage that, and then that links through to appointment booking, digital experiences. Often depends on the model, whether it's you need to book an appointment or whether it's a first in, first out type, jump online, get the next doctor, get the next mental health practitioner. And so you will then often have, there are various channel management capabilities out there. If you're building your own, you might use something like a Twilio or Amazon Connect, AWS Connect, or a Genesis Cloud or something like that from a channel management perspective to give you omni-channel management across phone, video, live messaging, asynchronous messaging, etc. And so that's obviously a key component, the digital experience component of that. So they will all, every service has a web experience, and whether that's a mobile app experience or a web app that is packaged up as a mobile app as well. They're the key components, and often in those services you'll also have some level of marketing type capability to do follow-ups and nudges and those sorts of things. Depending on the service, obviously you might have subscriptions and payment gateways and those sorts of things in there as well. So that's typically what you would see in that type of stack. And obviously those more of the contact center omni-channel management side of things, that has a bunch of AI assistants built into it as well. To allow some of that, and then you can also get specialist, health related AI assistants like Heidi that I'd mentioned previously as well.
Yes, and in the secondary and tertiary care systems, where what kind of new models emerging? I briefly mentioned about hospital in the home, but
care in the home, care in the home is a big one. So for those who follow the health, sort of large health players, St. Vincent's, who's a large national health provider here in Australia, is making a massive push into the delivering care in the home as part of their 2030 strategy that they've announced. Similar with Ampler Health and Medibank, we do a lot of care in the home because typically where it's clinically appropriate, so we're not about to do surgery in the home or anything like that, but where it is clinically appropriate, care in the home tends to be cheaper to deliver. It tends to be safer to deliver in terms of, complications, hospital-acquired complications in particular. And it tends to be a better experience from the customer's perspective, or patient's perspective as well.
And it eases pressure on the health system as well by not allocating beds unnecessarily.
100%. Though the beds that someone might have taken up can actually be used for those who are truly acute and need to be in a hospital setting.
Okay. At the start we discussed about the various policies Australian government is undertaking to improve the health system. I wanted to, supporting that conversation, I wanted to understand what specific technology initiatives, maybe at the state level or at the federal level, which have been initiated, uh, which are actually helping bring the healthcare system more connected?
Yeah, look, there's a number of different things there. So I mentioned previously the work that's been done by the Australian Digital Health
Yeah.
Agency.
Mm-hmm.
They are doing a lot.
Mm-hmm.
So they're really making strides. So they were involved, obviously, in defining those national fire implementation guides that I mentioned to you. They have a community called Sparked that get together and they work with the sector as a whole in that Sparked community to help actually shape what that needs to look like. So that's really great. They're doing a bunch of work with the My Health Record, obviously, as well, that I'd mentioned. So essentially, they're tackling the interoperability side of things, and they're tackling the how do we draw it together side of things with the My Health Record. So I think, from a federal perspective, that's really great to see. Once again, my local jurisdiction here in New South Wales, they've embarked on a very large journey to create a single digital patient record across the state of New South Wales, which they are rolling out through to all of the what we call local health districts here in New South Wales. And so that is covering off things like pathology and all of the hospitals and really pulling all that together at a state level, so that if I, as a person residing in New South Wales, go to any public hospital in New South Wales, my records will be on file there. So that's a really great initiative that they're doing there as well.
Right. Look, Matt, as we start wrapping up, I wanted to get your perspectives on how the technology within health is going to look like. What key trends are emerging over the next 5 years or so, right? Yes, technology has evolved fast in last 2-3 years, but the trends are definitely, there are many other things which can be done. So how do you see, both from at global level as well as within Australia, key technology trends which will shape the healthcare system?
Yeah, look, I think one in the AI space in particular, which I didn't mention previously, but I think it's worth a mention now, is the rise of health-specific AI capability within the public AI domain. So there are, specific capabilities that I believe will only get better within, ChatGPT, within Claude, etc. And I think what we will see in there is the old Dr. Google that people used to go, I've got this, tell me what it might be, is going to get a lot more advanced, particularly if we can feed, for example, our My Health Record into something like that. I think we're going to get a lot more informed consumers who might have more of an idea around what's actually going on with their health. And I think that's a really great thing. It can be dangerous if people start, not referring to the trained clinicians and just take that as gospel and do their own treatment based on that. I would not recommend that. But in terms of being more informed around, what might be going on with your health, I think that's a really great, sort of area that will probably continue to expand in the next 5 years in particular. The wearable technology side of things, once again, I expect that will continue to emerge and grow, not directly related to wearables, but one of the things we've been looking at is also around the utilization of things like your camera phone to be able to take images of, video of your face and then be able to do all your biometrics based on that. And the types of things it can, actually infer from just 30 seconds of video is quite amazing. So I think what we'll get to is we'll start to get more and more data. People will be more interested in, what's going on in my health. I think that will probably collide with an arm of medicine called precision medicine, where we will have, so precision medicine is around the genomic side of things. So we are seeing more people doing genomic testing. And I think what you'll find is we will get more and more information around what's actually going on from a, very personal perspective with my health based on my genomic sequencing, and things that I might be maybe can feed into that more preventative health space based on genomic sequencing and my risk factors and all those sorts of things. So I think there's some of the key things that I think in the next 5 years we'll certainly see more happening in space.
Yeah.
More.
And what's the role AR and VR is going to play, if at all, Matt, or is it still going to be science fiction?
Yeah, look, I think AR and VR is probably found probably more of a happy space in things like clinical training. I think we will see things, I haven't really gone into things like hospital technologies, but we will see a lot more things like robotic surgery happening, and controls of robots from, sort of that augmented reality side of things. I think is certainly an area from a surgical perspective that we will see more of, so that there is real precise minimal invasion surgery.
Okay. That's good. The future of healthcare definitely is looking bright, Matt. And
It's certainly interesting, that's for sure.
It is very interesting, definitely. And the way I would say is, it's at the end of the day, it's going to be all about, the future is going to be all about more access, more choices, and affordability and prevention, right? And how technology is going to enable all of these things, right?
Yeah, and definitely putting the consumer more in control of their healthcare themselves as well.
Absolutely. So on that note, thanks, Matt. Thanks for your time. It was definitely a very informative, insightful conversation. I'm pretty sure listeners are going to have going to take away many insights from this. So thanks for your time again. If you found this discussion valuable, please follow and subscribe to Enterprise Tech Talk. And thanks for listening. I look forward to seeing you in the next episode.